Hello viewers, welcome to our FP Live session. Today we have with us Dr. Jayalakshmi TK, Consultant Pulmonology at Apollo Hospitals, Navi Mumbai.
Right.
So today we'll discuss about what is the walking pneumonia and how it is different from the regular pneumonia with doctor. So doctor, first question is what is walking pneumonia?
Okay. So basically, pneumonia is infection of the lung. So whenever the lungs get infected and there is a patch in the lung, or there is a part of the lung which gets completely almost solidified because of infection, then we call it as a pneumonia. Usually, pneumonia is very serious, and the patient will have high fever, will require admission, injectable antibiotics, and patient will be really very sick. Walking pneumonia is when the pneumonia is milder, and although the patient has some fever and cough and maybe some chest pain, but not sick enough to be on the bed and is able to walk around doing their own thing, and hence it is called as a walking pneumonia. It's more of a colloquial term and it is not a very technical term as such. We can say that a milder form of pneumonia is sometimes called as a walking pneumonia.
Doctor, what are the symptoms of walking pneumonia?
So basically, in mild forms of pneumonia or in any pneumonia, the main symptoms are cough, fever, chest pain. Usually, the cough may have a sputum production or a expectoration, and this may be brownish, deep yellow. It may even be reddish brown in some cases of infection, like in Klebsiella infection. Sometimes even there can be blood in the sputum. So this is commonly what is seen in the pneumonias. And also there can be a mild chest pain, and the chest pain can increase on coughing, and the chest pain can also increase on deep breathing. So this is called as a pleuritic chest pain, which is usually different from how cardiac chest pain or other chest pains are. And usually fever may be there, which may be almost continuous, may be associated with sweating, weakness, body pain, headache. Often, if it started with an upper respiratory infection, patient may have sneezing, throat pain. So these would be the usual. Sometimes the patients can also have a nausea or vomiting, or even sometimes it may be abdominal pain, and there may not be the typical chest pain which is seen in a walking pneumonia.
So doctor, what are the tests we should do to detect the pneumonia?
So once we suspect that the patient is having some lung infection or some lung involvement, what we will do is a chest X-ray and a blood test. And often we will do a sputum test to confirm the cause of the infection. The X-ray may show a patch in the lung. If the patch is very small, it may be missed on the X-ray, and sometimes you may need a CT scan to pick up the patch. The blood test will show an increased WBC count, and the neutrophil part of the WBC count may be increased. The CRP may be increased. Also, the sputum may show more of cells, maybe deep yellow sputum, and if you grow the sputum, you may see the organism which is caused. In India, we should not forget tuberculosis, which in some patients may also present acutely as a fever and a pneumonic patch. So we should not forget that. Usually, that is not counted as one of the classic causes of a typical pneumonia. Also, we may have to do further tests, and on examination, what we get is patient may have signs which show that the patient is having a pneumonia in the lung. There might be some small wheezing, there may be some area of the lung which has a different type of breathing pattern which is seen. Some dullness may be seen on some part of the lung, so that may be seen on examination of the patient.
Doctor, how you will be treat this pneumonia?
So the pneumonia, if it's a severe pneumonia, the patient needs admission. But when we call it as a walking pneumonia and it's a milder pneumonia, patient is all right, blood pressure is all right, pulse rate is not too bad, patient is able to eat, there's not too much of nausea. In that case, we can send off the test and we can start the patient on oral antibiotics as well. And with these oral antibiotics, the patient, and we have to monitor the patient. Only if the patient is more serious, we need to admit the patient and start on injectable antibiotics, IV fluids, and maybe even oxygen the patient may require. So these are the two ways of treating the patient, either on OPD basis or by admitting the patient.
So doctor, my next question is what are the main causes of pneumonia?
So pneumonias can be several types. Usually it's acquired from the air organism which can cause the infection. Like there can be typical organism like a pneumococcal pneumonia or an H influenza pneumonia, or there can be atypical organism. Some classically we call it as a mycoplasma, or there can be viral infection. Like recently we saw COVID. Influenza is one of the causes of a viral pneumonia. So bacterial, atypical organisms, viral organisms, rarely there can be even fungal pneumonias. So these are usually the organisms which cause a pneumonia infection.
So how can we prevent this pneumonia?
So we can prevent the pneumococcal pneumonia at least by giving a pneumococcal vaccination. So this vaccination is typically given as two shots. The first is a 13-valent vaccination and the second is a 23-valent vaccination given anytime between 2 months to 1 year apart. This prevents the most common cause of pneumonia, which is a bacterial pneumonia, which is caused by the organism pneumococcus. Even a viral pneumonia like an influenza pneumonia can be prevented by taking the influenza viral vaccination. Can be prevented to a great extent, though not 100%. Recently, we saw that COVID pneumonias and infection can be prevented by wearing masks. These also can be prevented by preventing contact with the other infected people and by wearing masks around and avoiding too much of crowded places. People who are at high risk are very young children, elderly population, those who are diabetic, or those who have an immune suppression because they are on medications or they have severe kidney disease or some other severe diseases for which they are on chemotherapy medications, cancer patients on chemotherapy. So these are at higher risk for getting infection. So these patients need to be particularly careful. And otherwise, the good news about pneumonia is that if it is early picked up, it can be treated very well with the current antibiotics and medications which are there. So go to your doctor if you have signs of fever, cough, chest pain, so that we can diagnose it early and treat early and adequately, and we can have a complete improvement. The lung can resolve completely in cases of pneumonia. So that is the good part